What is diabetes? Diabetes is a disease in which the body does not produce insulin, or cannot use it properly. This is because of an autoimmune disorder that causes inflammation and damages cells in the pancreas. Full Body Health tell you all about diabetes, what it means for your health, and how to detect it early on before any serious damage can be done. This video will answer some of your questions about diabetes, and how it affects your body. We hope you find this helpful and enjoy. In this video, Full Body Health cover: what is diabetes, type 1 diabetes, type 2 diabetes, gestational diabetes, symptoms of diabetes, effect of diabetes, treatment of diabetes, how to deal with diabetes. Diabetes is a disease in which blood glucose levels are improperly regulated. Normally, the body keeps blood glucose at a fairly constant level by releasing insulin, or glucagon, into the bloodstream when necessary. There are three primary types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes. Type 1 diabetes occurs when beta cells in the pancreas stop producing insulin altogether. This form of diabetes usually manifests itself before age 40, and there is no way to prevent it. It is an autoimmune disorder where the body attacks its own pancreatic cells that produce insulin. Type 1 diabetes may be mild at first, but the disease progresses over time, until insulin shots are required, just to maintain blood glucose levels within normal range. The earlier this form of diabetes is diagnosed, the more likely it is that beta cells will regenerate and insulin production will resume. However, there is no way to prevent type 1 diabetes. Type 2 diabetes. Type 2 diabetes also happens when the body does not produce enough insulin, or does not use insulin properly. This form can often be prevented with weight loss and lifestyle changes, such as eating right and exercising. Gestational diabetes. Gestational diabetes is a specific form of diabetes that occurs only during pregnancy and usually clears up after the baby is born. Symptoms of diabetes: frequent urinate, pee, often at night, increased thirst, increased hunger, lose weight without trying, are very hungry, have blurry vision, have numb or tingling hands or feet, feel very tired, have very dry skin, have sores that heal slowly, have more infections than usual. Effect of diabetes. Diabetes affects all areas of the body, including the skin, liver, heart, and nervous system. Symptoms include frequent urination and thirst, which indicate that the body is going through a large amount of glucose in a short period of time, as it tries to process too much sugar at once. This can lead to diabetic coma or death if not treated quickly enough. Type 1 diabetes may be diagnosed as early as 4 years old, while type 2 diabetes may not manifest itself until 40s or 50s. Often there are no symptoms other than those mentioned above. Gestational diabetes usually happens during the second half of pregnancy. Blood glucose levels are checked regularly throughout pregnancy to make sure that blood sugar does not get too high, hyperglycemia, or too low, hypoglycemia. If diet and exercise fail to bring blood sugar under control, insulin treatment may be needed. Treatment for diabetes. Treatment for all types of diabetes includes a healthy, balanced diet, with limited amounts of sugars and carbohydrates. Physical activity, stress management, weight loss, if necessary, medication, insulin shots or tablets, frequent blood sugar monitoring, and making healthy lifestyle choices, and in staying active. Daily foot care is also important, as nerve damage caused by diabetes can lead to loss of feeling in the foot and injury that can eventually cause amputation. People with diabetes should always wear shoes and socks, even indoors, to protect their feet from injury caused by heat, pressure, or rubbing. Diabetes cannot be cured because it is a chronic, long-term disease. However, it can be managed and controlled with treatment and lifestyle changes. Symptoms like frequent urination and thirst will go away once blood glucose levels stop fluctuating. Diabetic medication will help reduce these symptoms as well. The longer someone has the condition, the more likely they are to develop complications, such as blindness or nerve damage. That may require additional treatment such as surgery. How to deal with diabetes. A positive attitude is key when dealing with any chronic illness, like diabetes, and learning all that you can about diabetes. Talking with your doctor regularly to ensure proper treatment, taking medications as prescribed, getting regular exercise and stress management. Following a healthy diet plan, participating in diabetic self-management, education classes or programs. Being supportive of loved ones, who may have the condition with you, are all ways to increase the likelihood of successful long-term diabetes management.